A rough road isn't the same as a collapsed bridge. Both slow you down, but one stops you entirely. In closing this debate, there's a simple distinction that's often missed in the public discourse, the difference between mental well-being and mental health. Every one of us faces challenges that affect our mental well-being: stress, burnout, grief. But fortunately, not all of us experience diagnosable mental health conditions. Recognizing this nuance helps us talk more openly and responsibly about what support is needed, for whom, and where. So here, at the heart of this bill, are quite literally the most vulnerable in our society. Tonight, we've debated not how Parliament serves the powerful, but how it protects the most vulnerable while upholding freedom, how it safeguards the public without surrendering to fear, and how it balances the need for control with the imperative of compassionate care. You see, mental incapacity may dim a person's ability to choose, but the law must never let it extinguish their right to matter. Reform of the mental health law must recognise that protecting someone from themselves or others is not carte blanche to own their life, but simply to borrow the reins for a time, to steer to recovery, handing them back when agency is restored and fully equipped to chart their path once more. So turning to the debate, we've had personal testimonies here today. The member for South Derbyshire talked about her mother being sectioned. The member for Bermondsey and Old Southwark talked about his mother being sectioned for schizophrenia. The member for Winchester of his friend who died of suicide. The member for Dorking and Hawley, his friend who was murdered. The member for Thurrock and her personal experience with OCD and bipolar. The member for Aylesbury with postnatal depression and suicide of a friend. The member for Southend and West Leigh spoke of Sam, his friend who died from suicide. And the member from Stroud, his close relative, sectioned for psychosis. It shows that it really does get to the top of the nation to be discussed and is at the very heart of every part of our communities. Turning to the debate itself, the member for Winchester talked about the problems with professions, particularly doctors, vets, and farmers in terms of suicide. The member for Bermondsey and Old Southwark said he had a ride along 3 times now with the police, so I'm pleased to see he's getting on so well with the police, but more importantly, his very valid point that this isn't the role for the police there. The member for Penistone and Stockbridge talked about autistic people and learning difficulties, using her specialist abilities in her professional aspect as chair of the APPG. The member for Runnymede and Weybridge, well, I think his CV is as long as the bill itself, but he talked about compassionate treatment, how to use the Act, and most importantly, the scope of the powers, because he talked about being, in essence, precise when you're using it. The member for Rochester and Stroud talked about the importance of support for learning disabilities and autism, and it's really important that this was about community, given last week was Mental Health Awareness Week, where the theme was community. The member for Dorking and Hawley spoke passionately about Fiona's campaign for Christopher's case, and we will look closely at this amendment when we are in committee. And the member for Sittingbourne and Sheppey, a nurse who also brings his professional experience, he and I both came into this house to try and change the NHS, and now, while we chose different sides, that passion is still clearly there. The member for Farnham and Borden also talked about his further experience of improving the system and policies to improve mental health care. And the member for Thurrock, a member of the Health Select Committee, as I was, talked passionately about OCD and bipolar and how important that is to show that people can achieve whatever they put their mind to, no matter how difficult the barriers in front of them. The member for St Neots and Mid-Cambridgeshire made a passionate and moving tale about Declan and the tragic story. And actually, it's really helped to bring to life what can unfortunately go on in this country. The member for Whitehaven and Woking spoke about his higher level of suicide in his area and the importance of making sure that that's identified. The member for Dewsbury and Batley talked about the racial discrepancies, and that's really important. The key thing is seeing the evidence as to why this is happening and make legislation effective on the back of that. The member for Ashford talked about, as a mental health care nurse and chair of the APPG, personalised care, which is so important. And that led on to the member for Guildford, who also talked about putting the patient at the centre. The member for Southampton and Itchen talked about local services like Lighthouse and No Limits, showing again the community support. And the member for Leicestershire South talked about placement of children. That's something we will very much be looking very closely in the committee. The member for Mid Cheshire pointed out social media and the importance of how it can have an impact on young people's minds. And the member for Strangford, well, this house's mental well-being wouldn't be the same without hearing his dulcet tones coming from the back. The member for Blackpool South talked about the mental health charities that he's seen firsthand and how people suffer. And the member for Aylesbury rightly shone a light on the spotlight on maternal health that often gets missed in this conversation. The member for South West and Lee talked about men's mental health, a passion I have, and he was right to point out about the men's mental health strategy the government is bringing forward, and I encourage everyone to take part in it. The member for Worsley and Eccles rightly talked about learning from others, and we've definitely done that in this debate. And the member for Stockton-on-North talked specifically about Men's Shed, and I'm looking forward to his campaign for Labour for lawnmowers when it comes to their next manifesto. The member for Stroud, he and I have both seen our handful of patients own time with mental health issues, and I love his idea and what will hopefully be brought forward in this plan as well, about having management plans already decided by the patients, so when they're in crisis, they're already dealt with. And last but not least, the member for Dartford talked about the cumulative attention across this House that leads us here today, and I think that's really important, because that's where we are. We've heard the summary already about the first Mental Health Act was introduced in 1959. But I am shocked not once but twice to find I am also the same age as the Mental Health Act 1983 and share the same year as the Health Secretary as well. Now, in 2007, under the last Labour government, there was the introduction of community treatment orders and independent mental health advocates, all aiming to increase the support for people at risk of being detained and allowing patients who have been detained to be discharged in the communities if certain conditions allowed. However, valid concerns were raised. Both sides of this House have said and agreed that more needs to change, and I'm pleased to see this bill builds on the work of the previous government, which made significant strides on addressing the long-standing disparity between physical and mental health. As has been mentioned, in particular, the former Prime Minister, now Baroness May, commissioned the independent Wesley Review into the Act, and I too would like to pay tribute for their work in this journey. His report built on the principles of choice and autonomy, least restriction, therapeutic benefit, and people as individuals. And since then, the Conservative government worked to create a draft bill which underwent significant scrutiny, as we've heard here, even have members part of it, for the need and recognition to get this right. Much of Wesley's report recommendations are here in front of us tonight, built around advanced choice documents, improving advocacy, reform of the community treatment orders, and changes around autism and learning disabilities, to name some of the 150 recommendations. So as His Majesty's official opposition, I'm pleased to stand here today and say that we support the principles behind this bill. We will work constructively with the government to scrutinise and improve it all through the committee and ensure that we pass good legislation that will do what is intended. Now, I know the Minister understands that progress in principle must become progress in practice, so I would like to jog his memory of some of the questions asked by the member from Melton and Syston. Does the Minister believe there's enough treatment facilities, particularly in the community? Are there adequate places of safety for people being detained once police and prison cells are removed? Does the mental health tribunal system have capacity to deal with more cases? And with the abolition of NHS England as they commission specialist mental health services, what will happen here? Does he believe in hitting the mental health investment standard, and will he commit to doing so going forward? And to that end, will he set out a timetable for this House, the services and the public to all work towards to be held account to? Madam Deputy Speaker, there is little greater moral burden than deciding for someone who cannot decide for themselves. Where care ends and control begins. Make no mistake, this is what this House is grappling with here tonight and through the course of this bill. Involuntary care should never be the first instinct or answer, but a resort to prevent harm to both the individual and those around them. Compassionate care therefore demands precision. Without precision, you simply have sentiment. And as His Majesty's opposition, we will endeavour to ensure that the government's sentiment becomes commitment.
Minutes.